Hello everyone, my name is Dr. Jacobs. I'm a doctor of physical therapy and I'm the inventor of advanced soft tissue release ASTR specialty. I'm also a cancer survivor and I used to suffer from chronic migraines, headaches, pain and fatigue before I invented ASTR specialty.
So Christine, tell me what's going on with your foot.
So I have a lot of swelling in my ankle, and it hurts when I run a lot. I play tennis, so I do a lot of like side-to-side movement and a lot of abrupt stopping, so that really hurts. And then like when I'm just like, after like a long day of working out or playing tennis, when it walks, like I can feel like it's like a throbbing kind of pain, like right where you see the swelling, and it hurts to like go like that. And then go up, I can really feel it, like, to go up. Like
so what happened here? It's looked like you have like swelling there, so how did you injure it?
So apparently, like, 2 years ago, I tore a tendon in there.
Okay.
It was, like, I guess, due to overuse, because I don't really, like...
Which one? Can you show it to me?
I think it was, like, in here somewhere.
Okay, is that why your bone is sticking out like that?
Yeah, I think so. And it feels kind of like it might be swelling, because I don't know, yeah.
So 2 years ago, you tore your ligament. How did you do that?
They think it was due to just like a lot of pounding, like just overuse.
Overuse?
Yeah.
Okay. So what happened? What kind of treatment? What did they do after that?
So I got PRP.
Okay.
And it took like 2 months off, and it did get a lot
Did
better.
they put it in a boot or a cast or something like that?
In a boot, yeah.
For how long?
2 months.
For 2 months after that? Okay.
Yeah.
And just give me update what other treatment you had for this issue.
I mean, I've gone to chiropractors, and like they've adjusted my feet, and worked on like my
You had
legs.
physical therapy?
I've never had physical therapy before.
Okay. So what current problem now you have? This has been going on for 2 years. So give me update about recently what's going on, how much pain, and what's difficult for you to do.
Yeah. So it got a little better after therapy, and I took time off, and like it was like fine for a year and a half, and then this summer, the past like 3 weeks, all the same like swelling, like it's always like been like slightly swollen, but now like the swelling that it had like when it was really bad has come back.
Okay.
And so like just the same pain, well, I guess as it used to be. So I would say like at the end of the day, it's like a 6 or 7, like, you know, I'm not like having to go like to the emergency room, but like it just really hurts. But like at the beginning, I always feel like the best in the morning, because that's like when it's like rested.
But when you put more weight on and you start to feel
by the end of the day,
you feel it. Okay, so we're gonna do the motion that aggravated now, and give me your rating for pain level from 0 to 10. And what kind of pain do you feel there? Is it sharp, dull, aching?
Like throbbing.
Throbbing?
Yeah.
Okay, so let's aggravate it now and tell me how much pain.
Okay. So like that, I'd say right now is a 3, just because I didn't do a lot of working out yesterday. It's the morning.
Okay.
So right now it's like not too swollen, and then that it's like also like a 3.
Okay.
Yeah.
What about the standing and moving around? Can you feel pain with that?
So if I like put pressure, like my weight onto like the right
Your
side.
Your feet is totally collapsing this way.
Yeah.
The left side. Okay.
So like if it's just like I'm sitting like this, it's like a 2. I can just like kind of feel it.
Okay.
And then like if I like were to like go like that, if I were to put pressure or like a lot of weight on my right, like I can like it's like a 4 or 5.
4 or 5. So okay, let's aggravate it. Stand on that foot. And tell me how much pain.
Like
Oops, sorry.
Like a 5.
5 now, when you stand like this.
Yeah.
So we're gonna use that as way to measure your progress, okay? So let's have a seat on the table there. I will take your range of motion, and the cameraman will remember the number of the motion, okay? So most of your pain is inside, yeah? Your pain is inside.
Yeah. I don't feel like any on the outside.
So the room is a little bit tight. Okay. So it's more in here. This is
that one, yeah.
more in here.
Yeah, like
And you can.
if you were to press really hard on the swelling, it would hurt. Just
Okay.
okay.
So can you see the swelling here? This area. It's a lot of swelling here. So your bone was protruded like this before this happened, or or it's just after the.
Are you talking about the bone?
This one, yeah.
Which one?
Definitely have a lot of swelling here. This
Which one?
bone is sticking out. It was like that before.
I would say it's probably just however this is.
Okay, so let's get the other side.
That's like probably the original because I don't.
The original, yeah, but this is like sticking out a little bit more. You can see the swelling and you can see
Yeah.
the bouncing.
And then
here.
like right, isn't it
So
like
this is
right
the
here,
pain.
right? Is this swelling right here?
So
too?
it's slightly swelling, yeah. So you feel it right in here, the pain, yeah?
I do feel it there too.
Okay.
This is like the worst, and like I do feel it here.
So
That's where I got my PRP injected.
Oh, okay.
Yeah, like a long time ago.
So let's relax, lie on your back. Okay. Make sure what I'm doing is not painful, okay?
Okay.
You feel the tightness there?
Mhm.
Okay. Too much? It's okay.
No, it's fine.
Okay. So just the chiropractor did the adjustment. Did they do anything else?
Like they use like this one machine that it's like it like vibrates really fast. It's like a massage,
Yeah.
just to loosen my muscles.
Yeah, I know.
But nothing
That's
like-
temporary.
Yeah.
Okay. So that swelling has been there since then, is that correct?
Yeah. Well, I mean, I would say maybe even like my sophomore year of high school, it just got really bad.
Mm-hmm.
Like my junior year,
Mhm.
and that's when I did something about it.
That painful here? You feel that band here? You feel that?
Yeah.
Okay. Make sure this is not painful. Too much?
It's okay. It kind of hurts.
Sorry. Okay. Relax, relax, relax. Alright, here you go. Too much here?
That's fine.
Okay. Okay. So, you're gonna work on your scar tissue here and see how you're doing with that. You're gonna feel cold, okay? Painful?
Oh no, I was just moving.
Okay. You feel that grinding?
Yeah.
And you can see the scar tissue around this area. I will let you see it after we finish, okay? You see the redness here? That's where it's actually grinding and that's where she has a scar tissue. So with the treatment, actually that redness should be decreased in 1 or 2 treatments. As soon as we break the scar tissue, things will start to clear up. Is that too much? Can I get a towel here, please? Do you have any problem? It's ticklish?
No, yeah, I just figured. I just.
You guys should know it's fun to be here, you know. So it's ticklish. Okay.
That's okay. Just
Yeah.
ignore me.
You see, it's a lot of fun, you know. Come here. Okay, that's okay. As long as you don't kick me, okay?
Oh, I will. You know what?
It's just ticklish, not painful, yeah.
Oh, it doesn't hurt at all. I'm super
Okay.
ticklish though.
Yeah, that's fine. Okay.
If you've asked anyone that's ever like massaged me, it's
Okay.
not good.
Is that too much?
No, it doesn't hurt.
Okay.
It's just ticklish.
That's okay. Yeah, I'm ticklish there too. Yeah, we don't try to tickle patient on purpose, okay? they are this way, you know. You feel
I'm
that scar
extra
tissue here?
sensitive though.
Mm?
I'm like extra sensitive than most people, I would say.
You feel the scar tissue here? And I will show it to you,
Yeah.
like really big. You see the redness here?
Oh wow.
You see that? Yeah. You see that? The scar tissue here? Here you go. You see the redness? That's where the scar tissue. So the way we know the scar tissue is the redness, the bumpiness, and you know, you feel it with this instrument very easy, and patient can feel it easily. Is that too much?
Nope.
Just fun, yeah? Just fun, yeah.
There's tickles.
That's okay.
I won't kick you, I promise.
It's okay. There you go. You see? Patient laugh, not cry when they come here. Okay. I had a patient actually. He was a doctor. Came for treatment for his back,
Oh really?
like lower back. And before I start to work with him, and he was like, "I just want to warn you." I'm like, "What happened?" I'm like, "I'm very ticklish." I'm like, "I'm just working on your back. It should be okay." It's like, "No, I'm very ticklish."
Actually, if you worked my back, it'd be worse.
Yeah.
I can't. If anyone touches my back,
Oh wow.
it's not good. Like I can't handle it.
I could not touch him.
Really?
As soon I was touching him, he was laughing so loud that his laugh was like by the waiting room, and everybody was laughing because he could not stop.
Really?
Yeah.
That's probably what would happen if I
And
had
I'm
a
like,
back
I'm
problem.
glad you warned me, but we need to do some work here.
Yeah.
Yeah.
Yeah, when I go in to get massages, I have to tell them specifically, I'm like, you can work on everything but my back.
Yeah. Okay, next time we're gonna work on the back. Okay. Okay, we'll clean this. And you can see where she had the scar tissue, and that should disappear in like 10-15 minutes. You see the redness here? It's all that scar tissue around this area. So we'll have you stand up. How does that feel? Peeing 0 to 10.
Feels better.
Any pain?
Like a little bit, but
0 to 10.
like 1.
Okay, let's stand on it. Let's move this. One leg stand, because that was 5 before.
Yeah. I would say like a 2.
Okay, where do you feel it?
I feel it like right where the swelling is still.
The swelling there? Let's have a seat there.
Right here?
This.
Okay.
Where do you feel it?
Right where the swelling is.
In here?
A little higher.
In here?
Yeah.
Is that painful what I'm doing?
No.
Move it now. How does that feel?
Feels better.
Gone or still feel it?
I still like slightly feel
How
it.
much from 0 to 10?
Still say like a 1 or 2.
You feel it right in
Yeah. Like if you probably were to like go up like right where it was, it would hurt.
here. Here?
Yeah, right there. That's like right where.
Is that painful what I'm doing?
Not yet. No.
Instrument. Excuse me. Too much?
No.
Mm-hmm. Okay, try it again. 0 to 10?
1.
1. Okay, let's stand on it. The whole body. Okay, go ahead. 0 to 10?
I'd say 1.
1? Okay,
Yeah.
that's not bad. Let's move it around. You can have a seat and move it around. Tell me how that feel. Zero to 10?
It's like a 2. Like, I feel like it feels a lot better.
Okay.
Yeah.
So can you tell the difference?
Yeah, I can tell the difference.
Yeah, so what do you think about the treatment?
I thought it was good.
Yeah, awesome. Thank you
Yeah.
so much.
Yeah, thank you.
Feel free to subscribe to my channel to get helpful tips on how to relieve pain. And if you are a healthcare provider and interested to be ASTR certified, you can follow the link below. You will get information on how to register for ASTR online class. There's over 40 studies that support ASTR treatment model, and also there's over 400 studies that utilize by ASTR treatment. And feel free to check over 220 videos that most of them actually real treatment videos. We'll see you soon.